Hi, my name's Haley and I'm going to be doing the sterile dressing change remediation video. I will have to move my phone just because my table isn't big enough to do it all in one area. It just wasn't working. So I grabbed to do the sterile part for my gloving. I'm going to grab my gloves. They would be all sealed up on all edges. I would double check all edges. Also for the remediation part, I don't need to do any of the beginning part. I already did all of that. So I'm going to dispose of this in my biohazard. I'm going to grab underneath my 1-inch margins. Okay, and this is a flat, clean surface. I'm going to pinch. I'm going to grab under the glove. Grab in the center. Dispose. Okay, I would still be in sterile, and I wouldn't be moving all this stuff around, but I'm going to do it for the purpose of this video so that you can see. Okay, so now I have my sterile dressing change, my wound, and my biohazard. Preface again, I would not be doing this in normal life, but it's just the camera. So I'm going to have a dirty hand and a clean hand. So first I'm going to open this up, get my caloric wrap. I'm going to drop it into my hand. This will already be cracked and broken, and I'm going to work from the inside and then on the outside. So going around one time, I would dispose of this. I don't have another one of these, so I'm going to use it for the outside, but normally you get a new one. Dispose. Piece of gauze. Same thing, I'm gonna drop it in your hand. Alright. Same thing, work on the inside first, on the outside. Patting dry. Dispose. On the outside. Dispose. Then, now that my wound is all clean, I would assess it for better visualization, making sure there's no further steps that would need to be taken or that a provider would need to be called in or anything like that. Alright, now for this portion, I can use 2 hands to apply this clear protectant bandage. So it has lost a lot of its stickiness for practice, so it would normally be clean. I'm going to place this starting in the center. Press flat. Normally you would remove that white edge, but for learning purposes I'm not, because I may need to do it again. I would label it with my Sharpie using it for my initials, the date and the time. And then I would remove my gloves. Clean up the rest of my supplies. Make sure the patient is comfortable. Hand hygiene. Leave the patient's room, shut the door, and document the procedure.